be chatting with you guys this afternoon. Hope you're all well. Just got my Health City people that just rolled in, which is always nice, so can be talking to them about what's going on over there at Health Centers. And so, good afternoon. Hi, Mr. Shamari. How you doing?
Hello, hello, hello. How are you?
All right, hang
Am
on
I
just a
on?
second. Start that again. Go
You
ahead.
see, you always want me to be quiet. You always make sure you have to
Oh, that's
control.
not gonna
You have to
happen.
control the volume and everything. But how are you?
I'm good. I'm good. I'm gonna make
I'm
sure that
I'm
we
liking
can
it. I'm seeing upgrades. I actually have a headphones today that I
look,
can listen to myself.
and you like that too.
Yeah,
So
to be able to moderate your tone, right?
yeah, I think it's your 11th job you're gonna have in your life is to be somehow in radio land doing something
No, I don't think so.
because you like the earphones.
I love the earphones.
So yeah,
Yeah,
so
but it's
so
just that
you want to be all
so
official
my,
all the
my
time.
children they wear headphones all the time.
Yeah, for
So
sure.
that's how
I
I need
still
to do.
haven't figured out the masking with the glasses because I'm like, it's either I'm gonna be, I can't see,
See, or
I
does it
be,
fog up?
geez,
Does it fog up your
yeah,
your lenses?
it's crazy. It's crazy.
Yeah.
Tiffany showed me a way, but anyway, she's not here, so that can't be helped.
I love your mask.
How is everything? You like it?
Yeah,
Cayman
there's a
Islands?
lionfish, no?
Yeah,
But
Cayman
you need to be showing the
Islands.
spear through the lionfish
I don't know.
because we don't want them.
No.
No, they're pretty, but we don't want them.
What to beat them to eat them?
Yeah, you have to like spear them then eat them.
Apparently,
Yeah,
yeah. There was this.
definitely.
There was this like some type of I don't know promotion years ago to beat
Right,
them, eat them because
right.
they
That's right.
apparently they like multiply a lot.
They do,
Very
and
fast.
they can
Yeah,
eat
that was a
things.
very Australian thing when they
Yeah,
wanted to get rid of the kangaroos.
Yeah. Oh jeez. Oh gosh.
and they can
All
eat things
right.
3 times the size of their mouth.
Yeah,
Ah, didn't know that either.
Yeah.
Okay.
yeah.
So
So
that's Dr. Alwyn Almeida. Tell me who you brought with you. Come
so
on.
wait,
Tell me who
Catherine.
you are and tell
Now,
me who you brought with you.
Catherine,
Come
did
on.
have you've met Dr.
Of
Alvin
course,
before?
of
Yeah.
course I
Okay,
have. I was letting
so
the
then why
listeners
am I introducing him?
because you know what, Tiffany
He's
always wants to introduce her people. Some y'all got to talk.
Yeah, no. You know Dr. Alwyn personally, and I am here, taking notes whether or not you remember who Dr. Alwyn
I
is,
literally can't even see who he
what
is at
what
some
his
point.
specialty is. I'm
All
gonna
right.
test you on our number and our email
You
and
okay?
Yeah.
and our website and all
What am
that
I
good
gonna
stuff.
win? What am
So
I gonna win?
Well, you could win a spot on our executive health promotion to be a star in a commercial.
I'm always on that. Come on, that's not winning. You guys are winning.
That's
Y'all
true.
count me
That's
on
true.
this thing.
Exactly. Thank you very much.
Exactly. I haven't seen
In the
it.
no in the new year.
Oh, I
You
want to
know,
see
yeah,
it. Oh, well, you
new
didn't last time. You didn't let me see the new.
new year, new you.
Okay. Well, I'll see.
So it's coming. It's
Sounds
coming.
good. All right.
So are you going to introduce Dr. Alwyn?
Yes, I am.
yeah.
This is
She's going to
Doctor.
she's going to tell the world who I is.
Well, you've been here a little bit, haven't you?
Yeah.
That's why his name is Alwyn. He from West Bay.
But
Right?
now, you see there? He came here. It was Alvin. He was here for like 6 months. He became Alvin.
Yeah.
Okay, Alvin Almeida, senior consultant, orthopedic surgeon, and head of the Department of Orthopedics. Yes.
Yes.
Okay, and so there is a little background that Tiffany loves to, she loves to really big up your doctor. She
Mhm.
loves that. And Shamari, he just wants to tell you what they do because he can tell you every procedure because he's paid attention to it. I know that. But Dr. Alvin is an orthopedic surgeon. He brings way over 10 years experience in arthroscopic procedures and joint
Yeah.
replacements. He has performed more than 4,000 orthopedic surgeries, including 600 joint replacement surgeries, 1,000 arthroscopies, and 700 arthroscopic ligament reconstructions of the knee. And he has a strong academic and research background, has presented many of his published papers. He's passionate about arthroscopy and joint replacements. He expected to play a pivotal role in advancing Health City Cayman Islands state of the art orthopedic department. And how long have you been here then, Dr.
Yeah.
Allen?
Been here 8 years now.
Oh,
Yeah,
okay.
going to be 8 in January. I think. Yeah, I came here January
Wow.
2014.
It's a long
Yeah,
time.
Mhm.
yeah.
He
I
was
realized
one
that
of the originals.
Yeah,
Yeah.
I realized that
It's pretty
paper needs
old.
to
Update.
updated with some of the numbers.
Yeah, because this is what you came with, right? So
Yeah.
now at this point, it's probably
Yeah, we
quadrupled.
yeah we've been 2004 I started practice, so more than 17, 18 years now of
Oh,
orthopedic
oh
experience. And
wow.
we've in fact we've done phenomenally well, thanks to all the love and all the confidence we got from the people, and such a brilliant job that Shamari and his team does as well. And I think I was just telling Shamari some time ago in one of the meetings, we've exceeded more than 3,000 surgeries just in major 3,000 more than 3,000 major surgeries in just orthopedics alone in Cayman Islands itself.
Wow.
We've done
Wow.
so. I've done close to 700 knee replacements just here, right?
Wow.
So that's a huge volume of cases we've been doing, and knee arthroscopies, shoulder arthroscopies as well. Quite a lot of those surgeries has happened. So almost, I think, 700 hip and knee replacements are included in that 3,000.
Right, right.
And that shows you that the volume of overseas patients that have come in, because there are not 700 knee replacements to be done in Cayman Islands
Really?
alone. Yeah.
Really? No, well, we got
So we
well
have
over
that.
700 knees.
Yeah.
Well,
But you've
But
had
not
a lot
everyone,
of people
yeah,
come
coming
in.
in as
Wow.
well.
Okay.
So, I mean, I think for knees and hips, we've had the most number of patients coming in probably from overseas. So that's why we our numbers in those surgeries are
Significant.
like that.
Okay. And that is obviously a testament to your area as well, as he said, Shamari.
well,
Yeah.
I mean,
Letting people know about.
right.
Of
But at the
course.
end of the day, if you have a good service, it's just like Cayman Islands. We used to talk about the fact we had to let people know that we're here. But
Right.
once we just want them to come taste the shores once.
Right, right.
And you know they're going to continuously return. And it's the same thing with Dr. Alwyn and his department. That once you get persons to come in to understand and see the level of expertise and have the experience with him,
They're coming back.
they not only they're
They're
coming
going to tell
back,
people.
they're going to tell everybody, and they're
Yeah.
bringing everybody with them as well, in order to make sure that, oh wait, you have a pain, better go see Dr. Alwyn
Right.
at Hell City, right? So
Right.
these are from many countries: Jamaica, Trinidad, Turks and Caicos, Honduras, all over Canada, US, all over. We've had persons flying in for orthopedics.
That's nice. That's
Um,
nice.
Especially because of we get trauma cases too, but with the orthopedic, it's, even though it's not elective in most cases, because you should get it done, it's considered elective, which means you can actually make a decision. All right, let me get on the plane, let me go there, let me look at all of the expertise that Health City has and that Dr. Howen has, and then make that decision to come and get it done. And the great thing about why we're here today as well is that the marathon was
All
this
right.
weekend,
Ah,
right?
okay.
And from the inception of the marathon, um, when I was with the Department of Tourism, they first approached us, and I would have been more junior at that point in time, we understood the benefits from an overseas perspective in regards to how many people run marathons, coverage you would get, as
Right.
well as getting heads in beds, as you would say. So when I came over to Health City, it only made sense to continue to sponsor it based on the expertise we would have in Dr. Alwyn and his department.
Right.
That obviously you're running joints, knees, and the such as impact that we definitely wanted to be a partner, so the persons know if there is an ailment, we're here for you.
Okay. All right.
Yep.
All
And
right.
this year, first time ever, we actually gave a coupon to all of the runners that if they have any issues or any ailments after the marathon, they can come see us for a free consult with Dr. Alwyn or one of his team, in order to make sure that we take the best care of them afterwards as well.
Okay. All right. There, it was just open for a joke. I'm gonna.
Was it okay?
So you do a marathon in order for them to come into the hospital. Listen now, look here.
But and then what we also do prior is we had a video whereby we were showing proper ways to stretch,
Right.
everything you should do to make sure you don't get
Need
Right,
injured.
to, you don't
right,
need to
right.
use that coupon.
Exactly.
Okay, yeah, because
So
I
we
was
tell
going to
you when
ask
you don't
you.
need to, and then on the back end, if you need to, then we're here.
Yeah, I was going to
Right.
ask about the short video. I think that's what you're talking about.
Yes.
Tips to avoid injury for
Correct.
marathon runners.
Yeah.
Okay,
So we don't want him to come, but
just in the event.
just in case.
All right, so that do you have an injury, experience chronic pain, or have issues during or after running or walking?
Yes.
And in that, so for the listeners, if they're also listening right now and they have just an injury or experiencing any chronic pain, or they have issues during or after running or walking, then Health City would be the place to come.
That's right.
And talk with Dr. Alwyn. Yeah.
I even remember when
Yeah,
we
we-
first started talking about orthopedics. Some people were like, "Wait, what? What is that?" And then
What's
when I explained
that?
it, they're like, "Oh, that's a bone doctor." And I'm like, "Well, you have joints in it. Yeah, bones." So yeah,
No, yeah.
Yeah,
I mean,
Dr.
we're
Bones.
not. Yeah, we're
it's
not trying to figure it all out.
it's everything, right, in
Right.
regards to all of your joints and the such. But for some people out there, he yeah, that's a bone doctor.
Yeah, because the joint isn't the bone. It's
And you
connecting
have
the
ligaments
bones.
and connect, but that's the bone. I got a friend of mine. Don't tell him any different. Yeah,
Right.
they're all bones.
Yeah, just go to Dr.
Yeah,
Alwyn.
once it hurts, go. Right?
Yeah. So Dr. Alwyn, talk to me a little bit about that. It's my question right away when you started talking about knee replacement, hip replacement. I started to think right away, is that like a degenerative thing generally? Is that as you get older or not necessarily? Talk to me a
Yeah.
little bit about
Yeah,
that.
so knees and I think all our joints and bones are not built to last forever. So we are going to degenerate. If we live long enough, we will all our bones are going to degenerate. Or the joints, to a point where you start developing arthritis. Basically, arthritis is lack of cartilage in the joints.
Right,
In your
okay.
hips and knees, you wear out the cartilage over a period of time.
Good.
Sports and a lot of other activities and maybe the professions that we are involved in, you would stress different parts of your body more than the others. Swimmers, for example, will have a lot of shoulder issues more often than any other joint in their body, and people who play soccer would naturally end up injuring their knees at some point if they are not careful enough. And so yeah, I mean, depending on how we are built, our anatomy and other things, we are prone to, and our genetics as well to a certain extent, you're prone to degenerative problems in various parts of your body. And I think sports injuries is another thing. Like say someone who runs marathons and does that for years and
Right.
years and years is
Right.
finally going to have some consequences on certain parts of the body. It's not that it might be serious, but it's something that will trouble him or cause at a later date when as you grow older. So important to know these things, and knowing prevention's always better than cure.
Yeah.
And that's why the video, because the video, and even we did two webinars with the organizers of the Cayman Islands Marathon. It was really kind of Rhonda, Kelly, and this one to help us out with those and organizing those webinars. And I think a lot of people benefited with knowing how to prepare, because everyone wants to run a marathon, and there are some people who are like the weekend warriors who just suddenly get up, including one of my doctors who just ran half a marathon without any preparation. Now,
Wow.
yes, some people can do it, but not everyone, and you
Right.
leave yourself open to, or you give a chance for an injury if you do such a thing. So it's important to know how to prepare. It's important to take it seriously and prepare not just with your exercise and your running, but also your diet and your preparation, and how you increase your tempo week on week, and you don't do it in such a fast manner that you expose yourself to a stress fracture or a stress injury.
Right.
So all these are important points, and especially as you advance in age, and then we have a lot of active people here. I mean, Cayman Islands, I think, I have to say that I see a large number of very active people. Obesity and other things are not so much of an issue. There is some of that, yes, but I do see a lot of people who are involved in sports and in different. I mean, you look at the number of leagues and clubs and
Right.
things that we have in the Field of Dreams and all. Like there is a lot of activity that happens on the sports field here. So they're a very active population, and also there is that middle-aged population which is very active as well. Now,
Right.
when someone like that decides to do a marathon, it's important to know how to prevent injury. Uh, and I think those two videos webinars that hopefully has helped a lot of people.
Yeah. Where can
And
can people still find those videos now? Where can they find them?
I
on,
think
on YouTube.
On
the
YouTube?
yeah,
Yeah.
the
Okay.
videos on Facebook and YouTube, the Health City one, the one we made for our marathoners, and then I think the webinars available on the website or something
Yes.
of the marathon organizers. They have it there.
All
They
right.
recorded the sessions. Yeah.
Yeah, and like you said, there was quite a great participation for the marathon over the weekend because
Yes.
I'm seeing here 5 relay teams registered from Health City alone,
That's right.
and as well as
We
some
are
12.
Health City.
Were you one of them?
I was there. I was
I knew that
present.
was a trick. That was a trick.
I was present.
Trick question.
I was present at the marathon. Yes,
I could see in your eyes you were not.
I
one of
was
those.
present at the marathon.
I'm never much of a runner, but
Were you, Dr.
the
Allen?
no, not this year. I'm actually recovering from some ailment, so I'm not at this time yet ready to start. But last
He-
year I did.
he did Badabanu.
Why
No,
did-
sorry, Kemas.
Why
Kemas.
didn't you? You know
Kemas.
what?
So
I'm looking at two, and I'm wondering why did you send someone in here to talk to me about that
See?
the marathon over the weekend? Because neither one of y'all can tell me really.
I was present. I
Okay,
was
so
there.
tell me about it. Tell me how
Yeah, I did,
amazing it
yeah.
was.
The marathon is amazing every single year that it occurs. They have these cool water stations that people are at that are themed differently. You have the half marathon, you have the full marathon. If you don't want to do that, you have relay teams within the marathon for those of us that don't want to run, over, 24 miles and the such. So
I've realized why the mask is good these days too.
Why?
It doesn't show the smirk on your face.
I have no sweat.
No, mine.
Okay, yeah.
Well, you're telling me
I am looking you directly in your eye and telling you
Exactly, and
how
I'm
great
like,
the marathon is.
Right. Yeah, that's
Yeah.
really good though. And I'm
Even the
so
governor
glad.
does it.
Of
Yeah.
course, yeah.
So why were you not there?
I didn't even know about it. That's
What?
yeah. I didn't even hear about it.
It's
Yeah, what's going on? What are
every
you guys telling?
first
What are you telling people?
Saturday for like the past 15 years.
Yeah.
Yeah.
Every
and-
first Saturday.
and ever
This is
since,
Cayman Marathon.
Yes.
Oh, of course I know about it. Yeah.
So
didn't
which
go.
marathon did you think it was?
No, I'm not a marathon person.
Uh-huh.
Oh, please, come on.
Yeah,
I don't even
we've
hand
been-
out the
Every
water.
first Sunday, sorry.
Yeah, I think we've been part of the marathon ever since I have come to the island. I remember, I think it's been 8 years now.
Ah,
We've been
okay.
actually partnering with
No,
the
it's
marathon.
great too. And I had spoken with some people maybe about a couple years ago, and they were like avid marathon people, right? And they said Cayman has so many, just like you were saying, Dr. Alvin, has so many of these types of activities going on
Yeah.
that throughout the year you could
Mhm.
literally be running a marathon
I know,
at
true.
least once or twice a month
Month,
if
yeah.
you wanted. There's some.
Yeah.
If you kept running,
Actually,
like,
yeah.
not-
Well, yeah, like the walkathons and
Right,
and
right,
they
right.
said literally for the
And-
entire 12 months you could be
Yes.
active if you
Yeah.
wanted.
A
Yeah.
lot of other people at Breast Cancer Foundation, the Cancer Foundation, they
Correct.
did it as well.
Right.
I actually ran the quarter marathon. I did the relay for the Cancer Society last year.
Oh, okay.
See?
So I was planning to do the marathon this year, but I got a little setback with
K
my
Mass?
health, and I had to.
From the K-Mass?
From
so,
Kemas.
so some
Yeah, that
unique,
jump
that was-
that jump
that
was- that
was
jump
long
was
ago.
good to you.
our marathon is
Kemas is also a marathon.
Yes,
How many
but
miles is
But
it?
it's
It
called,
is.
it's called a jumping.
but it's a different type of marathon, but
Yeah,
it's probably more
Right in and
intense.
jump
Yeah.
in.
It's
Yeah.
more intense than
Well, I think so.
Yeah.
And then there's liquor involved too.
well,
so you
if,
gotta be
if you
careful.
partake in those sorts
Oh,
of things.
come on,
but,
that's a big if.
if
Yeah, it's a part. It's a part of the whole process.
yeah, but some people just drink water.
Yeah.
Yeah.
Like if you
Yeah.
look at me, I will always have clear liquid in my glass.
Let me tell you, I had a friend that had a
Uh-huh.
clear liquid in her bottle. It said Aquafina,
Uh-huh.
and she was like, "Catherine, I will not give you any of my Aquafina because I know you don't drink, and this is vodka."
Really?
It was
That's
so
what people do.
I don't know.
Oh,
I did not know.
okay. I didn't know that
She was
either.
drinking Aquafina all
You
day. I
see?
was wondering why she was getting a
So I have,
little.
yeah, mine is clear, but it's, water.
Yeah, no, but I mean, it's a
Yeah.
part of it, right? So
Yes.
K-Mass was pretty interesting this
Right.
year
So
too.
so
So
what's
yeah.
so what's also interesting about our marathon, is that some tidbits in case you ever get quizzed on a
Okay.
game show,
All right.
right?
I'm getting prepared.
Cayman's marathon is the flattest marathon that is registered in now this I don't know. Whatever the association is that registers marathons,
Okay.
Cayman's marathon is the flattest, so it's one of the best marathons to actually run if you want a quick time.
Oh, nice.
Yeah.
Okay, that's good to
And
know.
it seems as if marathoners, in order to qualify for, let's say, your Boston Marathon, like those top
Right.
persons, you have to get certain requisite time.
Okay.
So at one point in time, persons were using our marathon as one of the marathons to help them to meet the time to be able to go into those other
Okay.
larger
All
marathons.
right. Great.
See?
Wow.
And
That's good to
KMAS
know.
is the only carnival march that ends at the beach.
Oh, so there you go. That's
See?
another
So those
quick.
are two tidbits.
Thank you.
See?
I mean, I'm
Just in
prepared.
case, $1 million on the line and you have to answer.
If we have any Cayman Jeopardy or anything, I'm
Exactly.
ready.
You're
And
good.
so thank you, Shamari. You always
I tell
deliver.
you, yeah.
That is within your reach.
Yeah, that's right.
Hell City
All of the
and
words.
the trivia guy.
That's right.
Absolutely. Dr. Alvin, how do you guys work with this man? Seriously. I was going to ask another question. We're going to take a quick
Yeah.
break in a little bit. But so when it comes to people coming in, to kind of get these things done, like the knee or hip replacement, what does that process kind of look like as well? Like obviously they have to come in, but they have to be scheduling certain things. So that
Yeah.
would have had to be a relationship building between you and them, or their doctor and you. How does that work?
Yeah. So a lot there is collaboration either through an overseas doctor or directly with the patient. In
Okay.
some cases, the patients will reach out to us directly. Like for example, from Canada, most patients wouldn't get a referral from a doctor, but then we would get notes and their medical records and other
Oh.
things. And then once I have their details and imaging studies, they share it generally nowadays with overseas. We can get like DICOM studies and other things to view MRIs and x-rays and all the
Okay.
other things.
Great.
And then we do a telephone consult or video consult sometimes to understand completely what the patient is going through. And I can't examine the patient, but through what I'm seeing of the imaging studies, through investigation notes from their doctors back home and through video calls, I can pretty much understand exactly what they need. And once they have, most of people who need a hip or a knee replacement or a ligament reconstruction or anything have already been worked up, and the decision has been done about what exactly is required. It's a matter of then scheduling. So once I feel that yes, that particular treatment plan is the correct treatment plan, and then we give them a date for the procedure. We give them information of when to arrive, how long before to arrive, and typically in a normal time before COVID, they would come 2 days before, get their blood tests done, MRSA tests, and everything done, and then surgery. To about 3-4 days in the hospital, another week, 10 days outside, and then return 2 weeks after the surgery.
Oh, okay.
So most of my hips and knees would return 2 weeks after the surgery replacement patients. Some of the patients who come in for sports surgeries would leave a little earlier,
Okay.
arthroscopies.
Yeah. And
We follow them up after post-surgery over video calls
Right.
at regular intervals as well.
and so explain what's the difference between the arthroscopy.
Okay.
Like, what is that?
Yeah. So arthroscopy is a keyhole surgery. It's where we put a little camera into the joint, and I'm able to see what's gone inside, and then I have another portal hole through which I can put in my instruments, which
Okay.
I would generally find very high precision instruments that can go in. We can use radio frequency lasers. We can use paragon probes and plasma probes to enable me to do certain types of things. Like I could either trim or smoothen cartilage, or I could repair cartilage, or I could regenerate cartilage or muscles using regenerative technologies. There are certain um, bioinductive materials that we use to help repair tissues in your joints, and that can help to regenerate some of your muscles and tendons. So we can do all those things through keyhole. It's generally more for sports people. So someone who runs marathons or plays sports is likely to have an injury that most often can be solved by an arthroscopic procedure. Basically helps us to get that person back to running or back to their sport again.
Okay.
So arthroscopy is something that you would use for minimally invasive keyhole surgery, where you want less blood loss, less tissue damage, more faster recovery, and all that. And generally more younger, active individuals. But then the joint replacements are for someone who has already degenerated the joint so much that now we have to replace it with a prosthesis.
Okay. Now, is it normal? And we're going to take a quick break, just, right now. But this statement I have, is it normally then, if for someone, an older person that gets a replacement, whether it's knee or hip, is it normal that they would limp after, or generally no?
No, they
So
should
that's,
not.
I think that's just a good question I want to ask.
Yeah, that's generally no. If so, most of my hips and knees, most of them, you wouldn't know they've had one unless
Wow.
they told you that they had one.
Okay.
But yes, but depending on each individual person, I would say some of them may have a little bit of a limp, or sometimes a little limb length discrepancy that which then we just can correct with some shoelaces or something. So that can happen at times,
Okay.
and there are some reasons why they might limp a little, but shouldn't be so obvious or bad.
Okay. All right. Well, we're going to take a quick break. You have been listening to Medical Monday. It's brought to you by Health City. This is your Straight Talk Drive Five show. I'm Catherine Tyson, your host, and you're listening to the voice of Dr. Alvin Almeida, who's a senior consultant orthopedic surgeon and head of the Department of Orthopedics, as well as Mr. Shamari Scott, who's the chief business officer and the chief, quiz preparer,
That's right.
in the event that you
That's
ever
right.
need to know anything about
$1 million.
marathons
Listen to
or KMAS.
KMAS.
He's your
Yeah,
guy.
that's right.
You are listening to Straight Talk. Don't go anywhere. We'll be back with more with these two gentlemen.
replacements now, in their 40s and their 50s. And sometimes when you have very severe arthritis at that age, you cannot tell them wait till you're 60 and then we do your surgery. You know, you want to be active. You want to have your best years of your life where you're financially, socially productive. You want to have pain-free, things, be able to enjoy those things and be productive. So, these materials now go a long way in those in helping with that. So we've been doing ceramic auxiliary knees, and we've been doing head and hips for the last 5 years
Okay.
using these materials.
All right. Okay. Now you were talking about the exertional compartment. Is it compartment syndrome? Yeah. Let's
Yes.
talk about that a little bit.
Yeah, that's an interesting thing actually. I wanted to bring that up because it's a very unique thing that I noticed that I had over the years in Finland. I have had three patients, and I have had several others who have like a chronic compartment syndrome. But I had three of them who developed an acute compartment syndrome after they ran the marathon. And
Okay.
I use that as an example to tell people to train, before a marathon because sometimes, typically, I don't know if you, some people experience this and I am one such who experience that. Whenever I run, my compartment, my outer side of my leg becomes tight and very, the muscle becomes really, really tight in that area, and it becomes a little hard almost because the muscle, all our muscles are covered in soft like compartments. There's a fascia of connective tissue that actually holds the whole muscle together, and it gives like a little pressure and it helps in biomechanical work of the muscle. But sometimes when the muscle is overworked, it tends to get swollen because of increased hyperemia, blood flow, other things. And then the compartment pressure starts getting larger. So
Okay.
once when you get high compartment pressure, it presses and reduces the blood supply, leading to anaerobic metabolism, leading to buildup of all kinds of inflammatory substrate that causes further muscle swelling, which leads to further, increase in compartment pressure, which then again blocks the blood supply. You see that you're going into a vicious cycle now.
Right. Right.
So if you're someone who hasn't trained enough, who hasn't stretched his ligaments enough, and you continue to do this, and you suddenly, you're not done anything at that, and then you're suddenly running the marathon, or you're doing some very strenuous activity, then you are at the risk of developing what we call as a compartment syndrome, where the pressure in your muscle, in your compartment is so high that we have to actually go into surgically release it. And it becomes a medical emergency because it will, it can result in muscle loss, muscle cell death. It can result in nerve death in that compartment, leading to permanent neurological weakness or, loss of muscle function or movement. It can result in sensory or numbness around that area. So it can be something that can be threatening sometimes. So it's better to um, prepare always for the marathon. Better to always stretch your muscles, and if you're feeling pain on that outer aspect of your leg, it's always better to get an opinion, get a test done. We have an option of doing called a compartment pressure test, where they put a needle into the compartment and it gives me a barometric pressure of how much so I can make a person run on a treadmill and then insert the needle at that point and understand if the pressures in those compartments are high or not. And then you can, sometimes you do it as an elective procedure. I had one guy who's a triathlete who does, and he's like one of those Ironman competition guys. Now, this guy was getting the same symptom and coming to me repeatedly. So we did a compartment release as an elective surgery. So with a small keyhole incision, I released this compartment. He's back to playing, running his marathons and this one again. But then it just, these are things that you want to be aware of, right? As a runner. These are warning signs. You'll start seeing tightness that on the outer aspect of the leg is and tightening or numbness going down your feet.
Yeah.
and you might find a lot of pain around that muscle area in the leg.
Right. Now, let me ask you, in terms of this obviously, these whole, kind of orthopedic, standpoint, when people are experiencing pain, I know sometimes they can talk about getting a shot, like a steroid shot. What is that in connection with what you do? Like, obviously that's a temporary fix or something. Is that not to the point where?
Yeah,
Let's
not
talk about that a little
yeah,
bit.
not necessarily temporary knock. It's just depending on what is your primary pathology that you're doing it for. So
Right.
sometimes you have a tendinitis or an inflammation, or you have calcification, and like a calcific tendinitis sometimes in the muscle.
Right.
Also, tendinitis, your muscle can actually form calcium, especially in the shoulders. So sometimes the steroid shot in those cases can be curative. It just takes away the inflammation, reduces the calcium, and then your good is new.
Okay.
So in some cases it can be a permanent solution, but in chronic joint arthritis, where they're going on, where say suppose you haven't yet reached the stage where you need a knee replacement or a hip replacement, but
Right.
you're painful enough that you need, you just can't continue like attend rehab, or the things are not helping much. In
Right.
those cases, you do use cortisone as an ointment to the
Right.
treatment. We directly inject it into the joints.
Right.
Steroids, cortisone are the most powerful anti-inflammatories known to man, so they to reduce the inflammation, at least temporarily take things care of things, and then you can maybe get back to your rehab and exercises more
Right.
diligently,
Right.
and then avoid things from getting too painful. It does help symptomatically
Yeah.
a lot, but too much of cortisone injections into the joint is also a bad thing, because you do develop something called steroid-induced arthropathy, the osteoporosis. So you want to be aware that you don't do it too many times, but
Okay.
up to 3 times in a year, I would say,
That's
is a
not
safe
bad.
thing to do if
Okay.
someone's having that much of trouble.
Okay. If it's solving the problem for that
Yes,
period,
because
but when you see it's something that you require more, then it could be a bigger issue,
yeah,
right? Okay.
yeah. Sometimes this whole process, like I have patients who have knee arthritis and other things, who are not yet ready for a knee replacement, but then they are still going through this journey of trying that, and just because they don't need a knee replacement right now, I can't abandon them. I need to make sure that they
Right.
are pain free, that they
Right.
can participate in all their activities, they can continue. It's a journey of life together,
Right. Right.
I
Yeah.
need to be making sure that they can do all that they want to do while they can do it.
Right. Of course.
At some point, yes, you'll have a knee replacement and you'll then be fine after that, but
Yeah.
you may still not be able to run or something. But I had a gentleman today, he runs a lot. Running is his thing. He wants
With
to,
with a knee replacement.
yeah, no,
Okay.
for before a knee replacement. But
Okay.
and he has arthritis, which I think will probably result in a knee replacement sometime in the future. Yes,
Yeah. Yeah.
but then uh, um, I don't want to tell him, okay, don't run now. You can in controlled environments, run, or we can
Right.
substitute by doing non-impact-based sports or other things. So I'm not going to tell him, okay, stay and don't do these things. I'm going to tell him, yes, let's try and see what we can do so that we can do these things in moderation and continue to enjoy these things till a point where finally you might need the surgery. Okay, then you do the surgery, but then through that process, your cortisone, rehab, physical therapy, all these things become a part of the treatment process.
Right. Right. Yeah. Now, I had heard many, many years ago, where with some of the pain sometimes that you're experiencing, whether that's your hip or your shoulder, is that it almost feels like the bone is rubbing
Yeah,
together.
yeah, that
Is that,
happens
yeah,
in
kind of common?
advanced arthritis. Yeah.
Okay.
So in severe cases, the cartilage, when it wears out completely, then it's bone on bone almost
Okay.
rubbing against each other, and that's when you see a lot of the cracking, popping, and the grinding, which can be quite painful.
Okay. Okay. And that's stuff
And
that
that's typically
yeah.
the stage you're in when you need a knee replacement or a hip
Ah.
replacement.
Okay. All right. Now, okay. Yeah. And can you actually run again? With knee
After hip or a
replacement?
knee.
Yeah.
I
Not
have told
generally.
my patients not to. Some of them do
Some
without.
of them do.
Just don't tell me about it.
Yeah. Okay.
But I'm
All
saying
right.
that yeah, we do advise not to do impact-based activities.
Right.
But a lot of them do get back to light jogging. Some of them get back to brisk walk. But
Right.
almost everyone gets back to brisk walking, cycling, and swimming. I
People
think
want to
the
get back to their life.
non-impact activities, electricals, they will be able to do most
Yeah.
of these activities.
Okay. All right. You're listening to the voice of Dr. Alwin Almeida. He is the senior consultant orthopedic surgeon and the head of Department of Orthopedics at Health City. It's Medical Monday brought to you by Health City. And I'm also joined by Mr. Shamari Scott, who's the chief business officer. He's been a little quiet this afternoon.
Because
Probably
you have so many great
coming
questions.
up with so much more, probably quiz stuff for me over there.
Yeah.
You got to keep busy.
I just need to mention that I'm in the corner and I was drinking Perrier. Okay.
Yeah,
Just
we
because
heard it.
just because it's a green bottle. I recall, pulling up to a drive and the person was like, "Do you think you should be drinking that?" And I'm like, "What? Water?"
It's a Perrier.
Yes, Perrier.
Love it.
So it's not a Heineken.
It doesn't look like Heineken.
Well,
Oh, stop,
green bottle
Shamar.
and
Nobody
people.
thought that.
Oh, well, I'm
Not
just
a
making
soul.
sure.
Yeah, that's when his mother said you shouldn't give greens away.
Yes, I do. Okay. The orthopedic department at Health City Cayman Islands diagnoses and treats a wide range of musculoskeletal problems
I-
affecting,
Mhm.
the hip, the knee, shoulder, elbow, wrist, and ankle. Ankle, not something you hear a lot about, but you guys work on that
we
as
do
well.
that as well. We
And
have
it,
4 ankle replacements in
oh
January, I
wow,
think.
wow,
So,
yeah. And it's expanded to include physiotherapy and sports medicine services, right? So some of the things that you treat, arthritis, as we've been talking about, knee injuries, occupational related injuries, shoulder pain, sports related injuries, stiff joints, tennis elbow. Those are some of the things that you deal with. Now, what is a tennis elbow? What is that?
That's an inflammation um, of the origin of some of the muscles
Right.
around the outer aspect of your
I've
elbow.
seen it, so I know what it is. I just wanted you to
Yeah.
explain it.
Yeah. So typically it's like a bit of a stress injury more often than anything else, where you multiple small stresses then leads to a little bit of a tear around the origin of the muscle.
Yeah.
Sometimes it's because of that. Sometimes it's because of an inflammation of where the muscle originates from the bone. We call it epicondylitis.
Yeah.
Sometimes it could be because of a nerve entrapment in that area as well, or a little ligament inflammation in the joint.
Yeah.
So these are all various reasons why someone could have tennis elbow, but the most common reason is a small tear in the origin of the muscle. And typically, when you have repeated movements of the hand, that's when you are prone to have a tennis elbow. Typically, the backhand or a tennis shot, that's when you would develop this issue. But there are lots of people who come to me with tennis elbow who have never played tennis.
Right. Right.
And that's typically because they're doing like say activities where they're ringing or they're doing repeated back and forth movements with
That
the
kind of
wrist
mirrors
and
the
all those
tennis
things. So that mirrors
thing.
the same
Oh,
movement.
okay.
Yeah.
Okay.
And then they end up having inflammation around that tendon.
Oh wow. Okay. All right. And so this looks like this voucher is still actually valid, right? Shamar, from what I'm seeing, it expires March 15th, 2022.
That's correct.
So if you have an injury, experience chronic pain, or have issues during or after running or walking, you're invited to book an appointment with one of the orthopedic consultants, could be
Because
Dr.
for the
Alvin.
marathon. So,
Yeah.
So you had to have been a marathon.
Oh,
runner.
so you wouldn't offer it now? Because you're always good about
no, you gotta
offering
go. You gotta
stuff.
go run. Go run the marathon, and then you get that.
Well, that's next year.
Yeah. So
Next
get
year at
prepared.
this time.
That's right.
But if they're in any pain, they can still come.
Obviously.
Come
Obviously.
on. Yeah.
But,
You're always giving away free stuff in Health City.
yeah, we are, but this one is special for the marathon.
Okay. So
So-
if you were in the marathon
That is correct.
and it was a lot of people.
They were.
All right. So in the event that you were in that and you happen to, come up with maybe something's going on with you,
We give you
Go
up until
to-
March to come see us.
yes, go to Health City
Definitely.
for sure. All right. So what are you gentlemen going to be busy doing then in the next couple of weeks as you prepare for Christmas? We'll talk about that. We're going to spend the next few minutes on that because Christmas is in the air. It's beginning to look a lot like Christmas. Have you seen Saving Christmas Island yet that my daughter wrote?
No,
And it's starring it at the Hartwell. You have to bring your children.
I know.
Saving Christmas Island, the musical,
Right.
that Health City should definitely have been behind 100%. But I came to you too late.
No, but we can still help with that.
Yeah, but definitely you need to bring your three commentantes.
Well,
They'll love it.
maybe one, because one
Right.
isn't gonna be able to sit through it, and the other one is too cool now.
They're gonna love it.
So he tells me, he's like,
But
what is
listen,
that?
there's Jasmine, there's Belle,
The middle one will come.
there's Rapunzel.
Levi will come.
Whoever's looking at girls will like it.
You think so?
Yes.
Oh, well, they're not at that.
Yeah, and
They're not
Caitlin,
at that
Caitlin
age
is
yet.
Moana.
They're still
Yeah,
up there.
it's amazing. Have you heard of it? You haven't heard? Saving Christmas Island.
We're gonna send it out.
Yes.
HR
I'll
communication. So
send it
everybody
to
can
you and you send it
Yeah.
out for sure.
see. Definitely.
But it's definitely a musical, and it's going to be December 18th and 19th. It was already November 28th and 27th, 28th. Now it's
I'm sure my wife will know about it because she's the one who keeps everything up and all these things. So
Okay.
She does all the planning. I just follow the orders.
well, I will definitely send it to Shamari, and he can forward it on.
That
to
sounds
you guys.
familiar. That sounds familiar.
Yeah, right.
Yeah.
Yeah, they keep the social calendar going. Yeah.
My son's been a bit of a musical guy. He's
Oh, nice.
performed in 3 musicals.
How old is he?
He's 14 now. So
Oh, he should love it.
Yeah.
Yes. No, definitely. I'll send it to Shamari for sure. But no, it's a beautiful musical and a good opportunity for the family. And obviously you guys work all year, and now it's Christmas time, and things are a little bit, just the dust settling a little bit. But you're there, within our reach for anything
That's right.
health related to make sure that everyone's mind is at ease,
Mm-hmm.
that they can come on out to Health City. So give us some of your contact information. Is that another quiz?
That is
640-4040.
There we go. And what email?
info@healthcity.ky.
There we go. 2 for 2, and one more to get your free consult.
No, stop it.
What's the
City.
website?
Healthcity.ky.
There we go. Custody.ky.
Hey, look at that. See?
3 for 3.
So what do I get?
You get a free consult with Dr.
Now you'll have to search for it research.
That's what I was
I saw you limping when you came in.
No, I was not.
No, I didn't see you.
Don't you dare put that
Exactly.
on me. Don't you put that on me.
Yeah.
No, that's what I was talking about, the shots. I'm not at the replacement point yet.
You seem so versed on all these orthopedic questions. I thought
Yeah,
it was from
man.
personal, you're like,
No,
me not clicking.
I got a lot of friends that graduated in the 80s.
All right, there we go. Yeah,
They got
that would do it too.
They got
Yeah.
some problems,
Yeah.
Yeah, and like you were saying, trying to stay healthy.
Mhm.
Even as you get older, really, because a lot of people are exercising because they're trying to stay healthy. It's like a catch-22. So the exercising, trying to stay healthy as they get older, but then the body is kind of breaking down, so you still need to ensure that you're taking care of yourself and you're okay. So that's where you guys come in, and obviously all the great work that you do all year round. And I just want to tell you guys, thank you from me on behalf of Straight Talk, Star 92.7, but also on behalf of Cayman Islands, all that you do for our community. We really, really appreciate that. And for people like yourself, Dr. Alvin, you have come all the way from your home and left people there to be here with us and to contribute all of these years to our community. And that's not small. That absolutely is not small. And I always want to say that, thank you all so much for that, because it just enhances what we do here, and it enhances our way of life as well.
Thank
So,
you.
for sure.
That's really sweet.
No, it's the truth, though. It's true.
Merry Christmas. If I don't see you, seeing as we're taking just a little break, we'll be
Yeah.
back February.
Yeah. There you go.
Two month break, and then we'll be back.
Yeah. So, Merry Christmas.
Happy New Year.
Happy New Year.
And that's it.
Happy Valentine's Day.
No, you'll be back before.
We'll be back before Valentine's Day. I was going to say Happy Super Bowl. Yeah.
Yeah.
But we'll be back.
Happy everything. Happy 2022.
That's right.
And best wishes for a beautiful new year
Yes. Safe.
with less
Stay safe.
incidents,
Yes. Stay safe.
no more
No more.
epidemics, pandemics, and
Yes. We won't wish that on
oh,
the
good
world anymore. Let's
gracious.
get out of it now.
It is
Yeah.
something, right? We've had enough.
We had enough. We're good now.
We're good. We're good.
Everything
we're-
lasted about 2 years. All
Yeah.
of the major pandemics. Which
Yeah.
two and 3 years.
We're
so
all stocked up.
so we're good. We had enough.
Yeah,
for our lifetime.
it's time for that dust to settle.
Exactly.
I think
for our
you're
lifetime.
absolutely right. Well, for those the older people that are talking about World War this, well, we went through our World War stuff. So yeah. But thank you all for sure for coming in this afternoon, and thank you for tuning in to catch up with Health City on Medical Monday. And of course, next year they'll be back. And wishes to all of you for a beautiful, healthy,
Yes.
and happy holiday season.
Definitely.
Gentlemen, get those trees up. If the ladies are showing you where the lights are, get them on the houses. Do what you need to do. Do your
Yes.
part, okay?
Yes.
Do your part.
Yes.
And ladies, don't
Or
feel
have a lot of
bad.
children and then let them do it.
Don't feel
Yeah.
bad about putting them to work.
Yeah. No.
Yeah.
Don't feel bad about gentlemen. Don't feel bad about making your children do the work.
No, I think we should make them do it. That's how they know about the Cuban, about the Christmas culture.
Of course.
That's right.
Yeah, that's what just that's what grows them up.
I finally, achieved what I wanted to achieve the other day when I needed one remote, needed other remote, and needed a glass of water.
You get that. You
And
get
I
that. You
had
get
three
that.
boys in sequence
Yeah.
getting me what I needed.
And you
I
were
was
like,
like, this is why I had children.
This is why I had more than one.
Yes.
I always tell people that. You had one child. What are you doing? One? Stop it. But yes, thank you all once again.
Thank you.
And thank you, listening audience. You guys take
Merry
care
Christmas,
of yourself.
y'all.
Yes, and have a great evening and great rest of the week and happy holiday season. Thank you, Dr. Allen. Take care. I am Catherine Tyson, your host. I'm signing off from Medical Mondays brought to you by Health City and bidding you a great evening. Take care.
Thank you, Catherine. Thank you.